Okay, so yeah, I will also talk again about the concept of the 3D biomimics stent and the induction of helical flow with a somewhat different touch as the previous speaker. So these are my disclosures relevant to this talk. As you all know, the 3D biomimic stent was commercialized in 2015. It's indicated for the use of the SFA and the P1 segment. And yeah, it is known for its unique helical shape, which distinguishes this kind of stent from any other stent that is being used in this area. And just to repeat on the concept of wall shear stress, I want to point out a few things once again. It's important to understand that wall shear stress is really a physiological stimulus for the vessel wall and in particular the endothelium. So in physiological conditions, you have a certain range of wall shear stress that acts at the vessel wall and stimulates the endothelium. So if the wall shear stress is reduced or increased, that can actually cause damage to the arterial wall, meaning the induction of the arteriosclerosis process. And this is another image which illustrates the physiology behind this. So with wall shear stress acting on the endothelium, arterioprotective substances are released that protect the vessel wall from the formation of arteriosclerotic plaque, which is different in a situation where the wall shear stress is pathologically reduced. And this can also be, I think, very well one can really very well understand how relevant wall shear stress is if you look at the carotid bifurcation. Because here the carotid bifurcation it actually it acts as a flow separator, yeah. And on the inner side, side of this bifurcation, you naturally have high blood flow, which causes high wall shear stress to the wall. However, on the outer side, the flow velocity is significantly lower, and also these kind of vortices form. And in that area, due to the reduced flow velocity, you have reduced wall shear stress. And if you look at the endothelium under the microscope, what happens is that in conditions of high wall shear stress, the endothelial cells they align with the blood flow, whereas in conditions with low wall shear stress, we have this kind of random pattern where the endothelial cells are not aligned with the flow. And in these conditions, the endothelium is more prone to build up arteriosclerotic plaque. And in the carotid bifurcation, this is what we typically see, that the plaque really starts to form at the outside of the vessel, not at the inside where the wall shear stress is high. So some introductory words on the concept of laminar flow. So laminar flow in a straight tube basically means that in the center of the vessel you have the highest velocities, and there are different means of depicting that, like in this colored images. High velocities are illustrated in red, and you find the highest velocity at the center of the vessel. Whereas if you move to the vessel wall, to the side, there the flow velocity is reduced. Now, if you look at a tube with a bend, then this center of high velocity gets shifted to the outer wall of this tube, and at the outer or at the outside of this bend, you have high velocities, which also causes high wall shear stress. Now, if you create a helical tube, then a swirling flow is induced, so the trajectory of the high flow velocities travels from one outside of those curves to the other. In cross section, if you look at the flow pattern, you see this vortex that builds up, and it's really important for understanding the context is that this still constitutes laminar flow, so it has nothing to do with turbulent flow. It's still a laminar flow, but with an additional vortex or vortical component in the cross section of the vessel. And this the center of this vortex is not steady, but because we're dealing with pulsatile flow, the center of this vortex actually moves during the cardiac cycle, and this leads to change in wall shear stress at the vessel walls throughout the cardiac cycle. So at a given time point, ideally all areas of the vessel wall are exposed to a higher wall shear stress. And as pointed out also in the previous talk, based on flow analysis, it's possible to actually calculate wall shear stress and then generate these maps where you can calculate areas of increased wall shear stress and areas where less wall shear stress is present. And to show that actually this helical flow also occurs under physiological conditions, we just have to remind ourselves of the conformation of the aortic arch. So this is a large bended tube basically, and these are real images of a patient using 4D flow MRI, where with this technique it's possible to visualize the blood flow in vivo. And what I think everyone can nicely see is that due to this bend of the aortic arch, flow vortex is induced, and this actually protects the vessel wall from injury. And in a study that we published in 2015, we actually looked a bit more in detail on this vortex, and using MRI techniques, it's actually also possible, at least in those large vessels, to quantify the vorticity and generate these kind of vorticity maps, where you actually can quantify the amount of vorticity in the flow. Also in other regions of the vascular bed, you have helical flow that occurs naturally, and this helical flow induces induced wall shear stress, which again, as I mentioned before, acts as a physiologic stimulus on the vessel wall and has a protective nature. And this also, from experience, we know that the straight SFA is far more prone to atherosclerotic lesions, stenosis, and occlusions, and also after stent implantations to re-occlusions, because just naturally this is basically a straight tube, with no helical flow induced, as opposed to the iliac arteries, which have this natural bend, and there you naturally have helical flow, which basically protects the vessel wall, and we see far less instant restenosis after stenting, for example, the common iliac artery. Okay, so coming to the biomimics, 3D biomimic stent, the principle or the idea that for this stent design was actually brought up by Professor Colin Cairo from King's College in London, and they performed the initial proof of principle study in 2013 in a pig model with 10 pigs, and they implanted 10 stents in the pig carotid. On the one side, they implanted straight stent, on the other side, the 3D biomimic stent. And what you can actually see from those DSA images already, that on the side where the straight stent was implanted, you have steady laminar flow, but on the side of the 3D stent, you can already get an idea of this helical nature of the blood flow that is induced by this stent. And then after 30 days of stent implantation, they actually looked at the grade of intima or neo-intima formation, and on the side where the straight stent was implanted, there was significantly more neo-intima that was formed as opposed to the 3D biomimic stent, or the side where the 3D biomimic stent was implanted. And to quantify actually the grade of curvature that is induced by this helical stent, you use this measure of curvature. So the curvature is higher when the radius of those circles that you align to the course of the vessel gets smaller. And in their study, they also look at the grade of curvature induced by the stent and correlated that to the grade of stenosis. And they were able to show that there's a very good correlation. So the higher the curvature, the less restenosis they observed. And then in the initial mimic study, they also try to match the clinical data with the physiological, or with the flow data, basically. However, at that time they were limited with regard to the imaging techniques. So what they basically did, similar to the pig study, after implanting the 3D biomimic stent, they acquired 2 projections, and from those projections, the 3D model was generated, and then based on this 3D model, CFD analysis was performed. So CFD means computer assisted fluid dynamic analysis. So these are basically mere simulations by a computer, or calculated using a computer. So, and here you can see the helical flow induced by the 3D biomechanics stent, where in the straight stent, in that case, they use the live stent. For some reason, the video is not running. Sorry for that. Try again. Okay, here you can see that in the straight stent, no helical flow can be seen. Okay, and this flow was also matched to wall shear stress calculations, and they could show that in the 3D biomechanics stents, wall shear stress is increased. So which other methods are available to actually demonstrate that you have this helical flow induced by the 3D helical stent? One way of demonstrating that is using a duplex ultrasound, and in a straight stent you would just have a normal color signal if you look at it in cross-section. However, due to the helix induced by the 3D helical stent, if you look at cross-section with duplex ultrasound on this artery, you would get this image. Yeah? So on the one side, the flow moves away from the transducer probe. On the other side, it moves towards the transducer probe. Yeah, when I actually first heard about this stent, I got very much intrigued, because in 2012 we did a study where we looked at different peripheral stents, and we used this 4D flow MRI technique that I have shown images on the aortic arch before, and looked whether this technique can be used to visualize the flow in peripheral stents. And actually we were able to show that in a number of stents it was possible to visualize the flow pattern inside the stent. Some stents actually caused severe artifacts. So in these kind of stents, it was not possible to look inside the lumen, but in a significant number of stents, it was possible to show the typical laminar flow pattern in those straight stents. So we came up with a study idea, and the question we had was whether this technique can actually be transferred to the biomechanics 3D stent, and whether we would be able to visualize the helical flow induced by the biomechanics 3D stent. We set up an in vitro phantom for this, where we placed the 3D biomechanics stent in a tube. And connected it to a pump. The water was heated to 37 degrees Celsius, and we applied steady flow. Yeah? So pulsative flow would have made calculations more complicated in the whole setup, so we decided to go for steady flow. And then we induced different curvatures by putting the stent in tubes with different stiffness. So a one-way stiff tube where the stent was not able to actually take up its helical form. And then two other tubes which were more compliant. And one of those tubes was stretched. So in that scenario, the curvature was somewhat reduced. And why did we do this? What is so special also about the 3D biomimic stent is that it actually reacts to stretching and compression, and which becomes very interesting in the distal SFA and the P1 segment in particular, because there are a number of mechanical forces act on the SFA and popliteal artery. And okay, I will skip this. This is actually can become relevant in patients where you have a stenosis here, and if you implant a straight stent, yeah, then you take away some elasticity of the vessel wall, yeah, and also the artery cannot shorten that much in a straight stent, and that can actually cause the stenosis distal to the stent to become actually relevant after stent implantation. And this is different if you implant the 3D biomimic stent, because the 3D biomimic which is actually of benefit to the action of the stent. Yeah? Whereas in a straight stent, you could even have actually the stent could even bend. Yeah? So okay, I'll skip this. So I'll continue with our experiment. So we put this whole in vitro setup in our MR scanner, and then we acquired 4D flow images and used the dedicated software to analyze it. And first of all, we had the question, of course, are we able to look into the stent? How much artifacts do we see? And we were very happy to see that no significant artifacts were seen, and we were able to visualize the flow inside the stent very nicely. And this is the 3D biomimic stent in a straight tube, in this very stiff tube, where the stent was not able to exert its 3D conformation on the vessel, whereas in this more compliant tube, it took up its natural configuration, and we were able to show very nicely using MR imaging that this helical flow actually gets induced. Yeah. So as opposed to the CFD images, which are only simulations, here we were able to show that it's for real. Yeah, the helical flow. And this is a fly through to the vessel, and around here the stent starts, and then you see that, of course, it takes some time for the helical flow to be induced and to start. Yeah? But then you can see very nicely on those cross sections the helical flow. And here, this is also another illustration where you see at the beginning of the stent, there's not much difference between the bended tube and the stiff tube, yeah, the straight tube. But in the center, yeah, you see very nicely the vortical flow. Also at the end of the stent, you see the vortical flow. And then using these different 3D conformations, we used again CFD methods to calculate the wall shear stress, yeah, based on our model. And of course, in the high curvature model, we saw significantly higher values for wall shear stress. And then because it's in such a small vessel as the stent, it's not possible to actually quantify vorticity as such, as I've talked about in the aortic arch. We came up with a surrogate marker. So we calculated the secondary flow, which is the flow component on the axial slides in relation to the flow in flow direction of the vessel. Yeah, and first of all, we compared it to the CFD calculations and saw that our MR measurements are very close to what the simulation gave. Yeah, and this for all three conformations. And then we plotted on the one hand the secondary flow, yeah, as quantified by MR, and then superimposed it to the wall shear stress. Yeah, and here you see it for the tube with the high curvature. Yeah, and you see that also along the stent. Yeah. The secondary flow matches very well also those peaks of wall shear stress along the stent, and in the straight stent, yeah, you secondary flow is very low, similar to the wall shear stress. Yeah, so it hardly alters. So in conclusion, we were able to show that by using 4D flow MR imaging, it is possible to visualize this swelling flow induced by the biomimics 3D stent. So we can really say it's for real. Yeah? The swirling flow is associated with a higher wall shear stress, and secondary flow and maximal wall shear stress, as simulated by CFD, show very close spatial distribution across the center line of the stent. And altogether, we in our experiment, we saw good agreement with regard to the quantification of secondary flow as well as wall shear stress between MR and CFD calculations. So there's also potential for in vivo imaging. So far, we haven't managed to do that yet, but in theory, it should be possible. So thank you very much.